Assalamualaikum warahmatullahi wabarakatuh. I hope all of you are still very excited to know more about the catheter-related prostate infection. This time around, we are still with the prevention part of the Crbsi. Now we are approaching the maintenance bundle. Yeah? So I hope all of you still aware, still awake. Yeah? If I may just recap back, we have two important bundles for prevention of Crbsi. Number one is about the incision bundle. So all incision bundle cover all the important points, all the important good practices that you need to comply during the incision of the central venous catheter itself. And now we are actually coming to the maintenance bundle. So what is maintenance bundle? It simply means that there's all the good infection control practices that we need to comply when the catheter is in place. Yeah? So what are they? Have 5 components. Number one is very strict hand hygiene. Nobody should touch the central venous catheter for whatever reason. Whether you want to give medication, whether you want to give TPN or chemotherapy, for example, without prior strict hand hygiene. Yeah? Number two is the use of alcohol for heart cleaning before we use the heart or the pot. Yeah? But not only the use of alcohol, but also we have to do what we call scrub the heart. So please check the subsequent video on how do we do the proper scrub the heart. Yeah? We provide you a video so that you can have a better understanding on how you can actually do the scrub the heart. And number 4 is the use of 2% chlorhexidine in 70% alcohol for dressing of the incision site. So this antisepsis is exactly the same as the antisepsis that we use to disinfect the skin before we insert the catheter, if you remember. And finally, local site inspection. Local site inspection for early sign of infection. So at any point you detect any sign of infection, please alert the infection control or the management team so that we can react to the early sign of infection very well. Type of dressing. Yeah? We have 2 types of dressing. One is transparent semi-permeable membrane dressing. So this type of dressing is easier because we can inspect the incision site easier. And if you use this dressing, the dressing should be changed every 7 days. However, if the patient is allergic or intolerant, please use the gauze dressing, or some people call it occluded dressing, and this type of dressing need to be changed immediately, 24 hours after the incision and every 48 hours or as needed. Yeah. So the CBC hub decontamination with 70% alcohol need to be performed every hub access. Yeah? As I mentioned earlier, whether you want to use that for blood taking, for TPN or for chemotherapy, it should be clean or should be clean with 70% alcohol. And not only that, not only clean or not only swab or clean with the 70% alcohol, but also we need to do what we call scrub the heart, yeah? Which we can check in the subsequent video. Another important thing is that to flush the line with 20 ml of normal saline prior to and immediately after accessing any urine. And because this is very important to make sure there is no remnants of blood at the lumen area, which may facilitate the infection. I think that's all for this part. As I mentioned earlier, please do check all the videos that we provide to facilitate your understanding. Thank you.